Hi, good morning. I'm a nurse practitioner student at Auburn. My name is Caitlin Esther. Today I'm going to be doing my head-to-toe assessment on Stephen. Stephen, is it okay if we do this head-to-toe assessment?
Yep.
Okay. Now, in real life, we would be doing this without the clothes on, but this is going on YouTube, so we're going to keep the clothes on for modesty's sake. And first, I would assess his gait while he's walking in the room, his general orientation, his long and short-term memory by interviewing him, that kind of thing. And like I said, in a clinic setting, we would be doing this without clothes, so I would be inspecting the skin as we go. But we're not going to do that today, so I'm just going to talk through it. First of all, I'm going to assess his general appearance, any signs of distress, skin color, height and build, estimated weight, sexual development, that kind of thing. And would obtain vital signs, which we're going to say they were normal. And then we're going to proceed with the assessment. First, I'm going to start by inspecting the head. I'm going to look for symmetry, any lumps, bumps, irregularities, any deformities, and I don't see anything like that. Then I'm going to look at hair distribution, any parasites, any infestations, inspect the scalp, also look for any abnormal moles, which I don't see anything like that. We're going to move on to palpation. I'm going to palpate the scalp, look for any signs of tenderness, any lumps and bumps that are not apparent on inspection. Tell me if it hurts. Okay, looks good. Alright. Then we're going to move on to the eyes. I'm going to look at the eyes, check for any redness, swelling, drainage, check hair distribution of the eyebrows, eyelashes, look for any irregularities, which they look symmetrical. Conjunctiva is pink, that's clear as white. Looks good. I'm going to check the visual field. I'm only going to do this on one side for the video, but we would be doing this on both sides. He's going to cover his left eye, and I'm going to cover my right eye. And tell me when you see my fingers.
There. 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 There.
Okay, very good. I'm going to need you to follow my fingers just with your eyes. Okay, very good. I'm going to move on to the ophthalmoscope exam. Turn it on and test it on my hand. Make sure it's set on 0. And again, I'm only going to do this on one side, but we would be doing this on both sides. I'm going to step up here for a second because I'm a little bit short. Okay. Cover your eye. Okay. Bright light. I'm the better influence. This side of the eye. Alright. And his disc margins are clear. Arterioles look good, no narrowing, no abnormalities. So, yeah, his pupils were reactive to light. I'm gonna check both pupils at this time, make sure they are equally round and reactive, about a 4 millimeter, which is normal. Okay. You would also be testing visual acuity with a Snellen chart, which I do not have today, and we are not able to do that because that he would have to be 20 feet away from that. But I would ask him to read with one eye covered, the smallest line he can read on there, and based on that, we will determine his visual acuity. All right. We're gonna move on to the ears. And again, I'm only gonna test one side for the video, but in an actual clinic setting, we would be doing both sides. I'm gonna look at the outside of the ear, do an inspection, look for any lumps, bumps, tenderness, redness, any drainage. I do not see any of that. Pull on the pinna, push on the trace a little bit. Any of that tender? Okay, that's good. All right. We're gonna look in the outer part of the ear canal, and there's a little bit of cerumen, which is normal. You know that amount, color, consistency. Moving on to the middle ear and inner ear. Look at the tympanic membrane. Okay. Look. Nice and pearl gray. Good cone of light. Now this looks fine. So that is a normal finding. I'm gonna next check his hearing. First, I'm gonna check it with the whisper test. I'm gonna stand behind him and ask him to repeat what I say.
Three, two, B.
Yes, very good.
B50.
Yes, all right. Very good. Next, I'm going to check bone conduction and air conduction with the Weber and Bryan test. First, I'm going to strike the tuning fork and put it on your head. Tell me if you hear both sides equally or one side.
Both sides equal.
Good. That's normal finding. All right. Now, I'm going to put this behind your ear. Tell me when you stop hearing it.
There. I can hear it still that way.
Okay. And air conduction is greater than bone conduction, which is a normal finding. And again, we would be doing this on both sides, but for the video, we're only going to do it on one. All right. We're going to move on to the nose. I'm going to look at the outside of the nose. It looks normal. I don't see anything asymmetrical, any swelling, lumps, bumps. Next, I'm going to palpate, look for any signs of tenderness. Any of this hurts. Okay. I'm going to turn this on. Yeah. And again, I'm only going to look at one side, but you would be looking on both sides. Now look inside it. nose. Look at the nasal mucosa, which is nice and pink. That's normal. Turbinate's nice and pink, no swelling. Septum is a little bit deviated. That is normal. I'm gonna also use this opportunity to palpate the sinuses. This is the funnel. Any of this tender?
No.
Okay. And this is the maxillary. Any tenderness?
No.
Okay. And we can also percuss these. Any tenderness?
No. Fine.
Okay. All right. We're gonna move on to the mouth. Open your mouth for me. Okay. Say ah. Okay. Uvula rises appropriately. That's normal. Can you stick your tongue out for me? Okay. Tongue is midline. That is normal finding. Can you move it side to side for me? That's good. Normal. Raise your tongue up and look at the bottom of it. Okay. I'm looking at the glands. They look normal. I don't see any abnormal growths. Mucosa is nice and pink under the tongue end. Alright, you can put your tongue back down and open your mouth. Mucosa is nice and pink everywhere else. That is normal. I don't see any abnormal lesions. Also been looking at the gums. Gums look healthy and pink. He does have some fillings. That is normal. Some downward. That is a normal finding. Right, stick your tongue out for me again. I'm going to look at your tonsils. Alright. See, tonsils are about a 2+. That is normal. And they have some folds on them. That is not unusual. Alright. This time I'm also going to be looking at his lymph nodes. I'm going to be palpating those. Here, auricular, post-auricular, occipital, lateral. Cervical chain, also here. Okay. Rear cervical. And I cannot feel them, which is normal. Alright. Next I'm gonna inspect the neck, and I'm gonna be looking at make sure it's symmetrical. The trachea is midline, that is normal. I don't see any goiters, any bulging. I'm gonna ask you to lay back for a little bit. I'm gonna check for any jugular vein distension. Lay back. No. Still. Again. Okay, I'm gonna sit you back up. Alright. Now I'm gonna stand behind you and gonna ask you to swallow so I can palpate your neck. Palpating his thyroid, which is, it was symmetrical, and I didn't feel any abnormal hardness or growths. I don't hear any audible wheezing or stridor. Can also auscultate the neck for carotid bruit. Normal. Okay. Next, we're gonna move on to the chest, and again, normally he would not be wearing his clothes, but today he is. I'm gonna look at make sure his chest is symmetrical. And so that's the inspection. We're gonna okay, I'm gonna ask you to sit up so I can look at your posterior chest as well. Okay. I'm gonna check for tactile premises. So I'm gonna ask you to keep repeat 99 as I go feeling your back. Okay, 99.
99.
Again.
99.
Okay.
99. 99.
Okay. And that is normal. Do it again.
99. 99. 99.
Okay. All right. I'm gonna ask you to breathe in. Okay. You can breathe out. This chest expansion is symmetrical. That is normal. All right. I'm gonna percuss your chest and listen for and stay up. Listen for any normal vibration. And chest was normal all over, resonant, but not hyperresonant, which is normal finding. Next, I'm gonna listen to you, front and back. Taking a deep breath for me. Okay. I'm gonna listen to the posterior chest. And his breath sounds are clear bilaterally, which is normal. Now, next, I'm gonna listen for cardiac sounds. So, let's lay back. And actually sit up first. What I'm gonna do is sit in the sunlight. And listen to aortic. Pulmonary. First point. Tricuspid. Mitral. S1 and S2 is normal everywhere. Now I'm going to ask you to lay back a little bit. Listen again. I'm going to calculate the point maximum impact. Right here, that is normal. Alright, we're going to move on to the abdomen. I'm going to pull your shirt up a little bit. First I'm going to inspect. The abdomen is symmetrical. Normal contour. It's flat. And with the abdomen, we auscultate next so we don't alter the vowel sounds. So, yeah. So I'm thinking about it. I gotta listen to your chest. To develop my stethoscope as well, just a second. Listening for any breathe. Good pictures, how it sounds. Okay, I'm gonna listen to the diaphragm first. Vowel sounds are active. Off all four quadrants. And listen to the bell. So what it feels like when you breathe. Next, I'm going to percuss the abdomen. And here there's some of the areas of tympani, where the fluid is, the areas of dullness, where the organs are. Percuss the liver. Try to measure the liver margin. Breathe in. Centimeters, that is more. Okay. Very good. Now I'm going to do light palpation. I'm going to check mostly for tenderness. Tell me if it's hurting anywhere. Anything?
No.
Okay. Next, we're going to do deep palpation. The purpose of this is more to palpate the vital organs, which a lot of times in healthy individuals, most of them can be palpated. Breathe in. like this way. Okay. Give me that. Okay, that is a normal finding. Okay, you may sit up. I'm gonna palpate your spine. And check for post-vertebral angle tenderness. Tell me if this hurts, okay? Does this hurt?
No.
Like this? Does this hurt?
No.
Now, in an actual patient setting, we would also be doing a genital exam. We're not going to be doing that today. I'm going to move to the lower extremities. And again, he's very close today, so I cannot really see them. But I would be looking at them for color, vascularity, any swelling, hair distribution, any joint, check his knees for any swelling, joint tenderness, anything like that. And also check the feet, check for color, vascularity, check if there's any swelling, and check the skin condition of the feet, especially on diabetics. But we're not going to make them do that. I will check your fetal pulses. Now check your and the popliteal. Okay, and we'll be checking the femoral too, which we're not going to do today. Radial, and the brachial. All of these are 2+, which is normal. Carotids, we check one at a time, so we do not occlude circulation to the brain. Very good. We're going to move on to reflexes. I'll check triceps. Okay. Forward. You lay back for me. I check. Okay. Now we're gonna do a quick neurological exam. Gonna touch you with something dull or sharp. This is sharp. This is dull. Can you feel the difference?
Yep.
Okay. Close your eyes. Tell me if it's dull or sharp.
It was dull. That feels sharp. That feels sharp. This was dull.
Okay.
That one's dull.
Okay. And we'll be doing this on the lower extremities too. Yeah, can you feel this?
I can feel it.
And this concludes my head-to-toe assessment. Thank you